I'm joined now by Dr. Paul Summergrad. He is the APA president. Thank you so much for taking the time. I know you're a busy man.
Thanks so much for having me here.
No problem.
Pleasure to be here.
So first off, I want to ask you, what are the major issues facing people as far as getting the right treatment?
So I think the first thing is access to care and making sure that people are covered by insurance and that there's adequate investment in services, whether that's hospitals, community-based services, general physician offices. You know, if you look at where people, at least in the United States, get most of their care for psychiatric care, it's really in the offices of primary care and general physicians. So they need a lot of help and support because they're a critical part of the system. At the same time, we need to make sure that there are an adequate number of physicians who practice psychiatry who can provide both the medical and psychiatric care for people who have psychiatric illnesses, especially people who have severe illnesses where they're often not cared for by other physicians. Remember, people who have psychiatric illness tend to be relatively young. Most psychiatric illnesses start before the age of 30. Most people don't have a lot of general medical conditions, some do, but they do have psychiatric illnesses, and so we become the physicians for people with serious illness who they tend to see more than any others. So we provide that connection both to the general medical environment as well as to making sure they get the right psychiatric care.
And serious mental illnesses affect all different groups, all different types of people.
Yeah, there's nobody that's immune. I mean, I have met people who are conservative, who are liberal, who are the sons of and daughters of extremely wealthy people and other people who live in poverty. There are people who are religious, there are people who are secular, and I get calls every single week, probably multiple calls a week, and the calls always start the same way. They said, I wonder if I could talk with you about something personal for a second. And I know it's either about themselves, about their spouse, about their parent, but most often it's a parent calling about a child. I've got a child with obsessive compulsive disorder. Where do I get the best care for them? I'm worried about them. I've got a child who has attention deficit disorder. I've got a child who has severe depression. I have a child who's developing a psychotic illness. And it happens all the time. It's actually one of the most important things I ever do is to connect people with care.
What are the major goals for your association, especially leading up to this year?
So I think there have been a couple of things that have really been overarching for us. First of all, again, in the U.S. context, we're in a period of what we call healthcare reform. We've been trying to figure out a way to do something that you've done in Canada for a long time, which is to have health insurance that covers everybody. And so we've expanded that under the Affordable Care Act. That has the opportunity to bring in and to make insurance available for mental health care for 65 million people, but that requires expansion of services, and it requires also the integration of care to make sure it's not separated from the rest of general medical care. So we've been very focused on that, on achieving parity and equality of treatment, because somebody shouldn't be discriminated against just because they have a disorder of their brain compared to a disorder of their heart. And then the other thing we're very focused on is two other things. One is we're at a time now of extraordinary capabilities in research, in neuroscience, in genetics. We have a fantastic researcher in what's called epigenetics, the impact of environment on genetics, from Montreal, who's at this meeting, Moshe Zift, who's from, I think he's from McGill. Carl Deseroth, who's from Stanford, who developed this entirely new technique of how to image the brain called optogenetics, is going to be getting the Meyer Award from us tomorrow. So focusing on building research, because ultimately, if we're going to make a difference in the lives of people, it's going to be because we know what really works for them most effectively. And then the other piece is really around making sure that we educate the next generation of psychiatrists and other caregivers, especially primary care physicians, but also non-physician mental health providers like psychologists.
Wow. Well, I think you're doing a great job so far.
Thank you.
Thank you so much for taking the time to talk to us.
It's a pleasure to be here.
All right.
Thanks. Bye-bye.